It's gone very quiet. It's not even 11 o'clock, but I think that reflects your eagerness to get going. So welcome to this parallel session on building resilience by improving health, nutrition, and knowledge. I'm Jeff Waage from the global panel on agriculture and food systems for nutrition. And it's great to see such a good turnout. We almost have a full house. There are seats for those who want to grab one. So nutrition and health have received a lot of attention during this conference on resilience. On the one hand, as aspects which are being dramatically affected by shocks and therefore needing attention and resilience strategies, but perhaps more importantly, it seems to emerge from the sessions I've been to, as building blocks on which healthy and resilient communities and economies are based. Particularly attention, for instance, is paid on the role of nutrition in the first 1,000 days from conception to 2 years in creating healthy people, healthy communities, vibrant economies, as sort of a platform on which shocks can be withstood. And in side events at this meeting so far in health and nutrition, resilience is linked to ecological systems and their own resilience, to the dynamics and resilience of agricultural systems and of food chains. So this session has been organized to explore how we might consider making agriculture and food systems that contribute to nutrition more shock resistant at the individual level, the community level, and the national level. And we'll be looking for answers to questions. The purpose of this is to generate some ideas, and those ideas will be fed back in the plenary, and they'll be an important product of this conference. So you have an important task, and I'm sure your heads are full of lots of questions. Some of the ones that have come to my mind as I've sat through these meetings, and this is only by means of sort of stimulating some thinking before you get some greater stimulation from our speakers, are questions like, what are the least resilient features of our agriculture and food systems? And who does that affect most? What age groups and what communities? Or how can a better understanding of gender roles in agriculture and nutrition help us to make food systems more resilient? What's the risk that sectoral separation of agriculture, nutrition, and health interventions and policies will undermine resilience? And what can we do about that? And then looking within our own sector, in our own agricultural sector, is there a risk that developing systems for resilience in agriculture and food security might actually undermine nutrition and health outcomes? And how do we avoid that? Those are some of the topics that I've noticed coming up, and I think some of those will be also addressed by our speakers today, who are going to stimulate our thinking, help us generate and focus our conclusions from this session. We've got an outstanding set of speakers. They're going to examine the theme of making agriculture and food systems healthy and resilient from a number of different angles, which I think will be particularly exciting. We're going to start with Dino Keating, to my right, Director General of the Asian Vegetable Research and Development Center, who will focus on agricultural dimensions of our challenge. Then Bonnie McLafferty, to my left, Director of Agriculture and Nutrition at the Global Alliance for Improved Nutrition, will look at this problem from the perspective of poor consumers and their dependence on food and markets. Charlotte Dufour, at this end, Food Security, Nutrition and Livelihoods Advisor at FAO, will help us to look at the profoundly multi-sectoral nature of nutrition and of resilience, and how these two areas have much in common and how this can be best exploited. And finally, Jonathan Schreier, Special Representative for Global Food Security for the U.S. Department of State, will put this in the context of how a development program should invest in agriculture and nutrition in a way that best ensures resilience. And then following our presentations, we'll have about an hour to develop some key ideas about how we make agriculture-related systems that deliver nutrition and health more resilient to shocks.